see a massive crowd here at 9 in the morning. So anyway, thanks very much for joining me and in this ICS stage. So what I'm going to be talking about today is a long-term technology partnership. So as a tech company, partnerships are massively important to us. And we're here, in fact, as part of a partnership today with Deloitte and Vodafone and the Centre for Health. So we've had a partnership with Vodafone stretching back more than 10 years now and encompassing a whole range of different services, whether it's power companies, banks, insurers, parts of government as well. And in the last 6 or 7 years, we've increasingly focused on the health side of things. So I'm going to be specifically highlighting a partnership that's been very successful in the integrated urgent and emergency care side of health, specifically NHS 111. So I'm just going to be talking a little bit about work we've been doing with an outfit called HUC, formerly known as Herts Urgent Care, but now covering a much wider geographical area than that. So in terms of what we're going to be covering this morning, there'll be 3 aspects. Quick look at the healthcare landscape, kind of how has this changed, what does that mean for the sorts of things we do. We're in communications technology, kind of how does that apply in healthcare. We're going to be looking at the HUC partnership, and then we're going to be rounding off with a little bit about us. We're not here for a kind of rah-rah about content guru, but I'll just kind of fill you in a bit more about what we do. So first, the landscape then. And so the important things to learn on the healthcare landscape are that this is very much a post-COVID health landscape. Still people sort of coughing away a bit. COVID's sort of at its last legs now. But what it has left behind is some big changes to how healthcare operates. So specifically, it's led to a real increase in the speed of digital transformation. So digital transformation was happening anyway, but really what the COVID pandemic has brought about is an increasing virtualization of that digital transformation. So we're moving away from the presumption of actually seeing a clinician in order to get help to people being much more happy, more at home with being dealt with on a kind of more arm's length basis. And that mirrors actually how the same people who are patients act as consumers when they're dealing with other kinds of organizations and kind of interacting with them a lot less face-to-face, a lot more virtualization and using digital tools. So a few trends then. Affordability. We're always hearing how the health service is short of money, and that more money is needed, more people are needed. And whilst that's one solution, tech likes to raise its hand and say that tech can help as well, in the same way that it does across other fields, by making things more efficient, more effective, automating more, making better use of sources of information in order that the people who are providing the essential health services can work most effectively and efficiently. So affordability, a key thing. Have many discussions about whether the NHS is affordable or not. It constitutes well over 10% of UK GDP, never mind government spending. So we can't spend that much more on it. So we've got to look at ways to add further efficiency. Personalisation. So that is a big theme that's emerged from the COVID era, or hyper-personalisation. Really across all fields, people want their data to be used in order to deliver treatment that's just for them. But at the same time, that data has to be treated with respect, be very securely handled, not leaked. We saw over the summer one of the main information systems used in 111 getting hacked, and that being a sort of major crisis. So personalization, scalability. So a lot of this is about leveraging cloud technologies in particular to scale up the best ideas and roll them out nationally. Accessibility, that means lots of things, not just the actual physical connectivity, which our colleagues at Vodafone are kind of happy to help with, where people maybe don't have internet connectivity, or there isn't sufficient connectivity to provide services such as remote patient monitoring and virtual wards, and that can be provided through wireless networks. But we also look at the accessibility of digital interfaces, things like WCAG2, so that all digital interfaces can be used by as many people as possible. Blended care, the idea of a kind of hospital without walls, so the same patient, the same individual being treated in the home environment, within the hospital, in an outpatient environment, across different health and care settings in a consistent way. And that again mirrors what happens in the consumer world. And then obviously tech partnerships. So you'll see a lot of different types of tech organizations here, all involved in partnerships with one another, with others such as network providers and consultancies, and with healthcare providers. So those are all kind of trends that we draw on. So these tech partnerships lead to innovation. Innovation always has to overcome obstacles, and the pandemic era has been very helpful in kind of knocking down some of those obstacles. Obstacles such as cost. So the costs of diagnosis, of treatment, all going up. So again, that's always a factor to consider. Scale. You can have the most promising pilot in a particular area or in a particular health setting, but very often it doesn't scale, it can't roll out, you can't make it national, can't make it global. So that's another obstacle often. And then trust. Patients want trust that their information is going to be used to provide this personalised care, and that information is going to be treated securely and with respect. So let's have a look at how HUC has drawn on these sorts of themes in order to provide an improved level of service through a tech partnership with ourselves, with Content Guru. So HUC first came to us, in fact we encountered them first back in 2014 as part of an NHS 111 Phase 2 pilot in Hertfordshire. In fact we worked on two with them, one in mental health, one in primary care. And then after that, that was such a success that they asked us to help them with their contact centre. So it started off in Hertfordshire, that's the H in HUC, but they'd acquired West Essex, and then they were integrating Cambridgeshire and Peterborough, and then they've got Luton and Bedfordshire. So they're bringing together these different areas, and actually it's not just 3.5 million now. Since last week, this is about 4.3 million. They've taken over running the 111 and urgent care services in Cornwall and much of Somerset. So it's continuing to increase in scale, and again that speaks to having a flexible technology partnership that can evolve with that scale. Another aspect is the cloud basis of our partnership. So because they move from on-premise technology, which is necessarily limited to where it's located in a physical endpoint, to the cloud, it meant that when the pandemic came, they were able to move to working from home very quickly. And of all the 111 providers covering the 40+ areas in which these contracts are awarded, they were the first to have home-based health advisors because that could be provided safely and securely from the Content Guru Storm Cloud. And then obviously we've got now a 6+ year working experience together, delivering some great services. So we don't just do 111 with them, they also run clinical assessment services, CAS, they run GP out of hours services, they run walk-in clinics, they have partnerships with hospitals and other health providers. That has led to lots of awards. Here's just 3 from the last year or so. This is actually a contact centre and customer service award. It's Europe-wide, which they picked up for services during the pandemic. Big one you'll have all heard of, a Health Services Journal Award. 2 weeks ago I was handing out the HSJ Award for Best ICS to West Yorkshire ICS. A year ago I was on stage with HUC picking up an HSJ Award for virtual ward, which I'll talk about in a moment. And they won an IT Europa award just a few weeks back as well. So they've gone from the traditional position of a 111 provider, being kind of under the cosh, under-resourced, facing difficulties, to one where they're innovating, they're doing loads of interesting things, different partnerships, and winning technology awards. So that's some tangible outcomes from this tech partnership. So here's a look at some things that we've done over and above the standard 111 service. So again, a pandemic era problem was that the 20% of people who call 111 and who need to be seen face-to-face couldn't very well be seen face-to-face, or not very easily or safely during the pandemic, because clinicians and patients alike didn't really want to gather together and catch COVID. So there were some technologies available that would enable remote consultations, video consultations. However, those had their limitations. In particular, often they involve installing an app or having some kind of appointment. So a lot of faff, in short, which is kind of not suitable for an urgent care environment where you just need to do something there in the moment. So we worked together and we took what was a demo that we put together some years previously for on-demand mobile video streaming, and we made it into a medicalized product with a clinical safety case, got it rushed through clinical approvals and safety approvals, got the safety case written, signed off, commissioners happy with it, all in the space of about 3 weeks, in order that they could have this service called Storm Link. And how that works is you're on a standard call with a clinician. Generally, it's one where a CAS clinician has called you back after a 111 consultation. The clinician decides, but you're one of the 20% of people that could do with a face-to-face consultation. Next thing you know, you receive a text message with a link in it. You click through that link. It's a one-time use link, so you can't go back to it. It asks permission and opens up your camera and screen on your phone, and suddenly you can be seen by that clinician. Lots of interesting things if you're into tech. We're keeping the streams separate, the voice stream, the video stream, how they're recorded is different, and the policies for storage can be different again. So that's an important thing that we did with Huck. It's even rolling out into police now. So from next year, in Scotland at least, you'll be able to go from a 999 call, upgun that straight to a video stream. That'll go into the control room, can go into digital evidence management. Police will know what they're going to find on the scene when they arrive, all without any need to install any apps or make any kind of scheduled appointments. What that led to, two main things really: closing out cases remotely and doing so safely with sort of higher degrees of confidence that that remotely closed case has been safely and correctly closed. Obviously, the decreased risk of cross-infection, clinicians, many of whom found themselves in vulnerable groups, some of them quite older clinicians who'd moved to this kind of remote urgent care model of work, definitely didn't want to be catching COVID and being put out of action. Patients didn't want to gather together. A visiting clinician could become a super spreader. That was all decreased. Obviously, easy for the patient. In fact, our slogan is engagement made easy. We always try and make it easy, disguise for tech. And then obviously the clinician working from home. Initially, the privacy aspect was addressed through a request to make the video one way. Later, in keeping with our own recommendations, clinicians decided that it would be better if it's two-way, but they could blur the background so that the kind of home couldn't be checked out, and the fact they hadn't maybe tidied up wouldn't come to the fore. So lots of impact, lots of benefits. Another one here is virtual waiting room. So again, people are often over-triaged in 111. They go through NHS pathways. It recommends they go to ED, but actually around half of those people don't actually need to go to ED. So what happens here in the virtual ward, if you are referred on to Addenbrooke's, you're in that Cambridge area, you go through to a virtual waiting room. So virtual waiting room is all about a list of people who you're now expecting to arrive in ED. A GP within the ED calls up the people who are kind of in that queue and then does a triage on them. So around half of those people who'd been referred to ED, thanks to the virtual waiting room, which I may have called a virtual ward in error earlier, but anyway, a virtual waiting room, around half of them could be filtered out. They don't need to come to hospital. There are more appropriate sources of care that they can be referred to. A very simple idea, really, but we won an HSJ award with that one, and we've been further developing it. And you'll see if you come down and see us in the Vodafone pavilion downstairs, that we're now taking that much further forward with intelligent dynamic queuing, that we're using contact center techniques for that. So again, you can have comfort messaging, you can have a video consultation while you're in the queue, you could go to potentially triage tools that you can navigate on your phone, which kind of takes us to the next one of these innovations. And I could have picked many more, but I just wanted to focus on 3 for the sake of time. So when you call 111, unfortunately, you often spend quite a long time waiting in a queue. So that time in the queue is generally wasted time, listening to messages telling you that you shouldn't have called 111, which is not very helpful when you're feeling ill. So the solution here is, let's use that time for some self-triage. You hold your position in the queue. Again, a bit like with the video service, you receive a link, you click through it, and then you go through a self-triage pathway. So that was using some third-party clinical decision support software from Health Hero in this case, or their forerunner. That guides you through a question and answer session on your mobile phone screen. So on our side, we're taking each question, we're deciding how to display that. Is it a scroll down? Is it a radio button? Is it a tick all that apply? As we submit the answers, we get the next question. We work out again how to display that. And you work through that process. At the end, you keep your queue position, and when you arrive at the front, the person taking that call can see not only what traversal you've been through in the self-triage, but also what are the probable causes of what's wrong with you. So you can again have a shorter and more focused discussion. So again, that efficiency theme, making the best use of clinical time. So all of that built Huck into being a real leader among the 16 or so organisations that provide 111 services. So also as part of a pandemic, NHS England looked at, let's try and level up how 111 is provided. So they looked at all of the different systems that were being used out there by the different providers, who were quite at liberty to provide whatever technical solutions they thought fit, leading to highly variable qualities of service. They picked on Huck because it's cloud-based, a very high level of quality, proven record of innovation and partnerships. And so they effectively made that the new standard nationally. And NHS England call it the single virtual contact centre. So one contact centre platform in the cloud for everybody to use, as it were, a levelling up measure. So that provides not just a single platform and a unified level of service, but also the ability to divide England into its 7 health regions and really work that effectively. So another part that contributed to SVCC was a further partnership we've been involved with since 2015 with Healthy London Partnership, providing the 111 service across the 5 ICS footprints of London and providing them a single dashboard, providing intelligent routing, automated services, linking in with lots of health and care information systems. So we'd proven how a region could work in London. We'd proven how, through a technology partnership with Huck, a virtualized contact center could work. in the cloud. And so those two elements fused together are now a single virtual contact centre, which has been operational in London for a little while now and is now rolling out across the rest of the country. So a few other things we've done around Huck as well. Apart from just handling the calls and doing the routing, connecting to information systems, there's also the auditing of health advisors and clinical advisors. So here we're using some AI tools so that we can get together the right number of different types of recordings for an auditor to analyse. Prior to this, managers would have to find, say, 5 types of recording for one kind of call handler, maybe 3 for another across a month. It would take hundreds of hours a month of manager time to do this. What can happen now is that they simply go straight in, we present them with, we told them I've got 3 minutes, even though I only started about 20 minutes ago, but anyway, we won't worry about that. So now with Storm Audit, we identify who you need to audit. Here are the recordings, you can go straight in and start auditing them. Mental health, again in the pandemic era, we made a connection with one of the mental health trusts within their area to their crisis line, so you can take that proportion of 111 calls that are really mental health in nature and transfer them straight to appropriate care. Natural language processing, again an AI technology which we're using to find out who people are, what they want, kind of early on in the call journey. So if we've identified who a caller is, we can open a case for them in Adastra, we can start filling in those case notes. And then at the end of the call, rather than simply summing up and the health advisor typing up all the notes, we can get all of that care advice, send it to the patient in a personalised web page with SMS and a link. They click through that link and then they can review their own notes, because evidence shows that people often forget what they're told. So they might have been told some certain complex things, they can't remember quite what they were told, so they go to ED. So the result of all that is an aim to take, from about an 11-minute call, around 3 minutes off. So going back to the first themes that I raised, it's all about making efficient use of resources through technology, rather than simply trying to increase the flow of water out of a tap to fill the colander. Other things we're going on to now include web chat, integration with the NHS app as well. So lots more to go. So I'll just round off with a couple of minutes about us. We're Content Guru. We are a Gartner Magic Quadrant contact center as a service provider. In fact, we're the only European-based contact center as a service provider in that Gartner MQ. Here's some of our people. They're not all as good looking as that. Most are engineers, 3/4 of us, in fact. We're part of a Redwood Technologies group, which is a big-ish tech company doing communications technology since the 90s. We work across the NHS on national programs. For example, every 999 ambulance call goes through our Storm Cloud platform for delivery. We're finding the first available agent in any ambulance trust in the UK to take a call when the local ambulance trust is busy, and then we can get that ambulance dispatched in the local area. We work with hospital trusts, with mental health trusts, all manner of NHS organisations, other large government contact centres like the overhaul of the DVLA or Universal Credit or Rural Payments Agency. Lots of these big government contact centres also run from our cloud. Police is notable at the bottom there as well, 999, 101, police transformation. In fact, we're the only cloud contact centre provider with 999 contracts anywhere in the world, as far as we know. So obviously with all of that, we've got lots of certifications, we win lots of awards. Obviously we win some of them with Huck. We've got a UK IT award from the ICS just a couple of weeks ago for our CRM platform, for example. And we're a typical fast growth tech company, over 30% growth last year, but sustainable, profitable every year. We've been around since the 90s. We aim to be around another 20 or 30 years, hopefully. So that's a bit about technology partnerships, how we have worked with Huck in particular, but also it's important to note that we work with Vodafone, we work with Deloitte, we work with many other organisations in the healthcare space. And we'd be delighted to obviously speak with any of you on our booth downstairs. It's called V1. It's in the Vodafone mini village that's down there. Or you can come and chat to me afterwards. So it's been a pleasure, and I'm glad the hall is filled rather than emptied while I've been talking. Thank you very much.